Hey guys, come along with me today to do this patient's tox. As you can see, we are treating the frontalis, so I'm starting out by finding that lateral border of the frontalis. I always have my patient clench here so I can confirm that I'm treating all the way over to that lateral border to prevent any spocking, and then I am moving across her frontalis and evenly spacing injection sites where I'd like to inject, making sure that my injection sites are about nickel to dime size apart so she gets in good diffusion. And here I am going up with a second row towards her hairline to make sure that she gets that coverage all the way up her frontalis. Here I have her close her eyes tight as possible for a brow lift so I can identify where I'd like to inject there, and then smile really big so I can identify where I'd like to inject for crow's feet. Here I am injecting the frontalis. We are moving across the frontalis. I always tell people to move in whatever way makes sense to you, whether it is doing the bottom line first and then the top line. Just make sure that you are moving quite quick so your patient is comfortable and they don't have to tolerate longer than they have to. And again, I'm injecting all the way over to that lateral border of that frontalis just to prevent any spocking of that brow. Just want to be mindful here just because you don't want to give them crazy brows. Here I am moving on to the glabella complex. I'm injecting that procerus at a 90-degree angle, 3/4 needle depth, and then the medial and lateral corrugators. Your medial corrugator should be 3/4 depth and your lateral corrugator should be half depth. As you go farther out on that lateral corrugator, the frontalis lays underneath that and that corrugator thins out. So you want to make sure that you're at a half needle depth so you don't hit that frontalis underneath and drop the brow. Here I am doing a little brow lift. So I have my patient close her eyes as tight as possible to identify that depressor muscle in order to inject toxin into it and to release that muscle and give her a little bit of brow lift. Be mindful that when you are doing this, that you are going light on the toxin above that in the frontalis, just because you do want to allow that brow to lift and you don't want to inhibit it with overdosing the frontalis right above that tail end of that brow. So I usually do a medial and lateral branch injection so I can get a medial and lateral lift. Here I am doing the crow's feet. I had the patient smile really big to identify that, and then I am injecting up and away from the eye. This injection is very superficial. I'm utilizing about half of my needle depth, and it is okay if this injection blebs. We do want it to bleb. You also have to be careful that this area does bruise a little bit more just because around the eyes has more vasculature. So keep that in mind while injecting.